Hello everyone, my name is Javonnie Lovett. Today I will be presenting on the life cycle of a medical claim. Understanding this process is important for new healthcare employees because every staff member has a role in helping the claim move from the patient first contact with the office through final payment. Accurate information, complete documentation, and timely follow-up all help healthcare providers receive payment for the services they provide. Mistakes at any point can cause delays, denials, or billing problems for both the healthcare organization and the patient. During this presentation, I will explain the major stages of the medical claim life cycle, including reg- registration, financial responsibility, check-ins and check-out, the superbill, claim submission, payer adjudication, patient statement, collections, and ways healthcare staff can help prevent common claim errors. The medical claim life cycle is a continuous process that begins before the patient receives care and continues until the count has been resolved. Each stage depends on accurate work being completed during the stage before it. The cycle begins with patient pre-registration and determining financial responsibility. It's then moved through check-in and check-out, creation of the super bill, preparation, and transmission of the claim, payer adjudication, the patient statement, and collection. This is why the cycle should be viewed as one connected process instead of separate billing tasks. For example, incorrect insurance information entered during registration can create problems later when the claim is submitted. When every employee understands the full cycle and complete their responsibility carefully, the healthcare organization can reduce delays and, and improve the overall billing process and patient experience. Patient pre-registration is the first step in the medical claim process. During this stage, the healthcare office collects and verifies the patient personal information before the appointment. This includes information such as the patient's name, address, phone number, insurance coverage, and other demographic information. Staff should always verify insurance eligibility and determine whether a referral is required. Consent forms and other necessary information should be collected so the patient record is prepared for the visit. This step may seem simple, but it has an important effect on the rest of the claim. Incorrect or outdated information can cause billing problems or claim denials later. Careful pre-registration allows the healthcare office to identify problems early, keep the patient's record current, and make the rest of the claim process more efficient. After patient registration, the healthcare office establishes the patient financial responsibility. This means determining what portion of the healthcare costs may be the patient responsibility based on the insurance information available. Staff may identify co-payment, deductibles, co-insurance, prior authorization requirements, and payment options. This information should be explained clearly so the patient understands what may be owed before receiving treatment whenever possible. Clear communication can help prevent confusion when the patient receives a bill later. It can also give the patient an opportunity to ask questions and discuss a payment plan when needed. Establishing financial responsibility is therefore important for both the patient and the healthcare organization. It supports a smoother billing process. It helps patients understand how their insurance coverage and personal financial responsibility work together. Patient check-in and check-out are important parts of the medical claim life cycle because they provide another opportunity to confirm that the information in the patient record is correct. During check-in, staff verify the patient identity, confirm insurance information, and obtain required signatures. If information has changed since pre-registration, the record should be updated. Co-payment may be also collected when appropriate. After the visit, the checkout process includes scheduling follow-up appointments, collecting the remaining balance when required, and providing the patient with a visit summary, or other needed information. Completing both processes carefully help maintain an accurate patient record. Accurate information supports the billing and coding process that follows the visit and reduces the chance that incorrect patient or insurance information will cause problems when the claim is submitted. The superbill, which is also called an encounter form, summarizing important information from the patient visit. It connects the services document by the provider with the information needed for the insurance claim. The superbill can include ICD-10 diagnostic codes, CPT procedure codes, ACP CS codes when appropriate, provider documentation, and information supporting medical necessity. Medical coding must match the services and diagnosis documented for the encounter. This may complete the inaccurate provider documentation, especially important. The information from the superbill becomes the foundation of the insurance claim, so an error at this stage can affect reimbursement. Incorrect or complete coding can contribute to claim delays or denials. Staff should therefore review the information carefully and make sure the documentation and codes accurately represent the services provided before the claim moves forward. Once the patient visit has been documented and coded, the claim is prepared and transmitted to the insurance payer before submission. Staff should review the claim for missing information, incorrect patient data, or coding mistakes. Correcting problems before the claim is sent can reduce the chance of rejection. The claim may then be submitted electronically through a clearinghouse to the insurance company. Electronic submission allows the healthcare office to determine claim efficiently and track their status. Staff should continue monitoring the claim instead of assuming that submission means the process is complete. If a claim is rejected before audit question, the problem should be corrected and the claim submitted again. Careful review and timely transmission help the claim move to the payer with accurate information and can reduce unnecessary delays in reimbursement. Payer adjudication occurs after the insurance company receives the claim. During this stage, the payer reviews the submitted information and determines how the claim will be processed according to the patient coverage. The review may include eligibility, medical necessity, coding information, and covered benefits. After the review, the payer determines the payment amount and communicates the results. The provider may receive an explanation of benefits or other payment information showing how the claim was handled. Some claims may be paid as expected, while others may be partially paid or denied. When a denial occurs, staff should review the reason carefully. If an error can be corrected, the claim may need to be corrected and resubmitted when appropriate. healthcare office may also follow the appeal process. Modern adjudication help prevent claims from being overlooked. After the insurance company processes the claim and the payment is applied, the healthcare office determines whether the patient has a remaining balance. If money is still owed, a patient statement is generated. The statement should clearly show the amount that remains, the patient responsibility after insurance process. Staff should make sure insurance payments are applied correctly before billing the patient. The patient may then pay the balance in full or discuss available payment arrangement when needed. Clear statements are important because patients need to understand what they owe and why they are being billed. Good communication can also reduce confusion in billing questions. Generating an accurate patient statement is an important part of completing the claim lifecycle because it transfers the remaining financial responsibility from the insurance portion of the claim to the patient. Follow-up payments and collection are the final stage of the medical claim lifecycle. If a patient balance remains unpaid, the billing department may send payment reminders, make collection calls, or work with the patient to establish payment arrangements. Staff should document collection activity and communicate professionally with patients about their accounts. Patient privacy must also be protected during the collection process, including the following HIPAA requirement when handling or discussing protected health information. The purpose of follow-up is to resolve outstanding balance while maintaining appropriate communication with the patient. Consistent follow-up helps the healthcare organization collect money that is owed for services already provided. When the balance is paid or otherwise resolved, the claim cycle for that amount is complete. This shows why billing and collection are connected to all of the earlier steps in the process. Preventing claim errors requires attention throughout the entire medical claim life cycle. Staff should verify insurance information at every visit, keep patient information current, use accurate coding, review provided documentation, and submit claim promptly. A mistake in one area can create problems later in the process, so quality checks should occur before the claim is transmitted. Staff education is also important because employees need to understand their responsibilities and how their work affects other departments. For example, accurate registration support correct claim submission, while complete documentation support accurate coding. Preventing errors can reduce claim denials, shorten payment delays, and improve efficiency. It can also help prevent patients from receiving incorrect or confusing bills. The best approach is to focus on accuracy from the beginning instead of waiting until a claim has already been denied. The information used in this presentation is supported by healthcare researchers listed on the reference slide, including the Centers for Medicare and Medicaid Services, the American Academy of Professional Coders, healthit.gov, and the U.S. Department of Health and Human Services. These sources relate to medical claim coding, health information, and HIPAA requirements. The references are included so the information presented throughout the training can be connected to reliable healthcare resources. Thank you for reviewing the life cycle of a medical claim.